Hey Natalie, that's right. So once again, we're here in Amherst at the Center for Orthopedics. And yes, you mentioned good food is important, but yes, good health is even more important. And especially when you find yourself in need of a doctor right away, this is one of those places that you want to make sure you visit because they are the premier destination for orthopedic care. And one of the reasons that they are so good at what they do is their team of trained physicians. And I'm with Dr. Frank Sabo. He's an orthopedic surgeon here at the Center for Orthopedics. And I want to thank you for taking the time to meet with us. Obviously, you and the members on your team, you're all busy people, but you're also so well respected in this community. You've been a part of this area and doing the things that you've been doing for over 30 years. Why is it important for you to give back in this way?
Well, being a part of the fabric of the community, raising my family here, getting to know the patients, I think that the art of medicine is creating a relationship with the patient, the right treatment for the right individual, and I think our group takes pride in that. We provide a personal service for the individual, and we're part of the community, every one of us.
We have talked about the fact that you provide immediate access, VIP or all-star treatment. What are some of the procedures that can be done and taking place here at the Center for Orthopedics?
Well, everything from spine surgery to hand surgery. We offer joint replacement, knees, hips, robotic surgery. We do robotic knees. We have, like I said, upper extremity team that does upper extremity surgery, sports medicine, arthroscopic, rotator cuff repairs, ACLs, weekend warrior athletes we take care of. We take care of teens, and we take care of the older folks in the community.
You know, you talked about the robotic technology, and I think what's interesting, is that called Mako?
Correct.
What's interesting is you found a way to utilize these advances in technology while also maintaining this one-on-one patient care where the patient feels like a member of your family because you're taking so much care in what you're doing.
Well, I appreciate that because that's what we strive for. Technology is really useless unless we can have the patient buy into what we're trying to accomplish. Like any technology, it's a tool,
Sure.
but the more that we can communicate what we're trying to accomplish, the better the outcome.
Sure. Dr. Frank Sabo, thank you so much for your time this morning. I want to introduce you now to another member of the Center for Orthopedics team. This is Dr. Brett McCoy. Thank you so much for joining us.
Thank you.
All right, so we're talking about sports medicine, and Dr. Sabo mentioned the word weekend warriors, and those are some of the people that you do treat here, but you also treat people of all ages.
Correct. Yeah, we treat athletes of all ages and you know, obviously parents, grandparents, and everything in between.
And one of the things I think that makes you stand out too, and I know you don't necessarily like talking about yourself, but you've held positions with a lot of the professional teams here in Cleveland.
Yeah, I've had the opportunity to work with most of the teams in Cleveland. I got a ring with the Monsters.
Did you really?
Yep, that's nice.
Nice.
And so I think one of the unique things about this location is if you look at the psychology of recovering from injuries or even just training and working out, we really strive to create wonderful environments for the athletes. And it's no different than if you're recovering from surgery.
Sure. And you mentioned things that make you stand out. I want to take a moment to have you kind of give us an idea of what it is that we're looking at here, because this is something that you're not going to find everywhere.
Sure. So these stay suites are essentially for overnight stays. So this would be predominantly for joint replacements. And so we have the ability to do same-day joint replacements, but it's hard to know ahead of time if the patient needs to do a little bit more work with therapy and needs a little extra care. So we have the ability to keep them in these really nice rooms. They're designed, so the bathrooms, there's stairs out here, everything is designed for a joint replacement.
Okay.
So you have a room that's warm and inviting and bright, and we have a team here that only works with specifically orthopedic patients. So it's a really nice place to recover. So if you have surgery early in the day, this is an opportunity if you need it. And a lot of people later in the day say, hey, I'd really rather be on my couch.
Sure, and it's a nice home away from home. Now, in terms of some of the joint surgeries, whether you're getting your shoulder replaced or your knee replaced or hip replacement, is it typical that people do have to still spend a couple of nights in a hospital after those procedures?
Yeah, so if people have significant medical issues, you know, we will generally do them at a large hospital. But for a lot of people, it's just a matter of maintaining their pain at an appropriate level to go home and then working with rehabilitation. And so lots of times it's an overnight stay for those. We use regional anesthesia, so we help numb things up, and then we're not completely sure of the pain demands afterwards. And so if we have any concerns about them doing well in a home environment, we have the ability to recreate that here.
Sure.
So if it's 3 stairs to get into your house, it's 3 stairs here. And
Right,
so, again, just like Dr. Sabo was saying, each patient is taken uniquely. But for most of the people who are active, this is a much easier environment to recover.
Sure. You know, and one of the things that I do want to say, just being here this morning at the Center for Orthopedics, whether it was with Dr. McCoy, Dr. Szabo, Dr. Marsh, Dr. Zanotti, or Dr. Weber, there is this commitment to the community where they are really just taking the time to get to know their patients. When they do go out into the communities, people are coming up to them saying, oh my goodness, I remember you did my mom's knee, or you did so-and-so. So if you do have an issue and you need to be seen that day, which in most cases you're hurting yourself, you're injured, you need to see someone, the Center for Orthopedics, this location here in Amherst, but they do have locations throughout Northeast Ohio, and they will take care of you. Dr. McCoy, thank you so much for your time today.
Yep, take
Stick
care.
around, more New Day Cleveland coming up after this commercial break.